Imagine dodging a deadly heart attack that was lurking in the shadows, all thanks to one man's insistence on checking his family's health. This isn't just a story. It's a wake-up call about how early detection can change lives forever. By Carrie Breen, News Editor. https://www.cbsnews.com/team/Carrie-Breen. Carrie Breen is a news editor at cbsnews.com. A graduate of New York University's Arthur L. Carter School of Journalism, she previously worked at NBC News Today Digital. She covers current events, breaking news, and issues including substance use. Read full bio https://www.cbsnews.com/team/Carrie-Breen. Updated on December 13th, 2025 /8:28 a.m. Eastern Standard Time /CBS News. Add CBS News on Google. https://www.google.com/preferences/source?q=cbsnews.com. Kevin Murray, a devoted dad from Tampa, has a deeply personal connection to the importance of keeping your heart in check. Back in 2003, he almost lost his life due to an undetected heart issue that required urgent bypass surgery, a procedure where surgeons create new pathways for blood to flow around blocked arteries. Now 72, Murray credits this brush with death for reshaping his entire outlook on life and health. Year after year, he faithfully attended cardiology appointments. But in 2021, he switched to a new doctor who introduced him to an advanced diagnostic tool, a cardiac CT scan. This cutting-edge test creates a detailed 3D picture of the heart and its blood vessels, making it easier for doctors and patients alike to spot potential problems before they escalate. For beginners, think of it like taking a high-resolution photo of your heart. No surgery involved, just a quick, painless scan that provides a clear view inside. Murray's own scan came back clean, just as he had hoped. Yet, it sparked a chain reaction of concern for his loved ones. His parents and grandfather had all battled heart disease, and his 67-year-old brother Patrick was starting to feel unusually tired and short of breath. After some heartfelt discussions, Murray persuaded Patrick to get tested in late 2022. The results were alarming. Patrick's scan revealed severe blockages in his arteries, putting him at serious risk for a catastrophic heart event, like a heart attack. He underwent immediate open-heart surgery, a major operation where the chest is open to repair the heart, which not only fixed his symptoms, but also motivated Murray's other 3 brothers to follow suit. As it turned out, every single one of the Murray siblings was grappling with advanced heart disease and required surgical intervention. My brothers and I are incredibly thankful that we dodged what could have been a total disaster. We were right on the edge, Murray shared with CBS News. But here's where it gets controversial. Is relying on advanced scans like this the gold standard for everyone, or should we stick to traditional risk factors like blood pressure and cholesterol? This technology reveals hidden threats, but some experts debate whether it leads to unnecessary worry or overuse. Dr. Mark Russo, a professor and head of cardiac surgery at Rutgers Robert Wood Johnson Medical School in New Jersey, emphasizes that a strong family history of heart disease is one of the biggest red flags for potential problems. If your family tree is dotted with multiple cases, like grandparents, parents, or siblings who face similar issues, it's wise to chat with a doctor about personalized monitoring strategies. For instance, if your dad had a heart attack and your mom has high cholesterol, that pattern might mean you need more frequent checkups to stay ahead of trouble. The Mays all consulted the same cardiologist, Dr. Alberto Morales, who has performed this type of scan on around 10,000 patients, including the family. He uses the Araneta Spotlight cardiovascular CT scanner, which captures the whole heart and its network in mere seconds. It's non-invasive, meaning no cuts or needles, and emits less radiation than a standard full-body CT, making it safer for repeated use. Russo likens it to a mammogram for breast cancer, but for the heart, a proactive way to peer inside and catch issues early. This scan lets us actually see the disease forming in the heart, Russo explains. We often rely on things like blood pressure and cholesterol levels as indicators, but those are just risk factors. You might have sky-high readings and still not have disease, or vice versa. With a cardiac CT and a calcium score, which measures buildup in arteries, we can spot problems much sooner than older tests. Morales adds that roughly 80% of his patients show no outward symptoms, yet are diagnosed with heart disease thanks to this scan. Blockages can choke off 80 or 90% of an artery without causing noticeable signs, which is why early detection is crucial. It prevents surprises like sudden heart attacks. Once diagnosed, Morales works with patients on a comprehensive plan: medications to control risk factors, lifestyle tweaks like healthier eating and more exercise, and sometimes preventive procedures such as cardiac catheterizations to unclog arteries. In some cases, these steps can slow down or even reverse disease progression. For example, adopting a Mediterranean diet rich in fruits, veggies, and fish, combined with regular walks, can make a real difference. And this is the part most people miss. While lifestyle choices matter, genetics can be an unbeatable force, sparking debate on whether we should accept our inherited risks or fight harder with tech. For the Maes, these cardiac CTs were transformative and quite possibly life-saving. Like their older siblings, Larry and Michael underwent open-heart surgery. Tim was teetering on the brink of a widowmaker heart attack, a severe blockage in the main artery that can be fatal despite years of living healthily. He received 3 stents, tiny tubes inserted to keep arteries open, as Murray described. Fortunately, all the brothers recovered well, and now check in with Morales regularly. Murray enthusiastically endorses cardiac CTs to anyone who brings up heart health, and he's ensured his son and nephews are aware of their potential risks. Russo suggests using family gatherings, like holidays, as opportunities to discuss health histories and encourage screenings. You can't outrun genetics, Murray admits. Sure, you can tweak your diet and stick to workouts, but inherited traits are tough to beat. I'm so relieved this technology was there to confirm my brother's issues. Now they're thriving. Edited by Lucia I. Suarez saying, https://www.cbsnews.com/team/Lucia-Suarez-saying. In health. https://www.cbsnews.com/healthwatch. Florida. https://www.cbsnews.com/tag/Florida. Heart disease. https://www.cbsnews.com/tag/heart-disease. What do you think? Should cardiac CT scans become a standard checkup for families with a history of heart disease? Or do you worry about overdiagnosis and costs? Is genetics destiny, or can we override it with modern tools? Share your opinions in the comments. I'd love to hear agreements and disagreements to spark a lively discussion.